I'm Shannon Green, and I suffer from non-epileptic seizures for 8 years now, and it has changed my life completely and my family's as well. Some days I can't really even get off the couch, especially if I've had a seizure that day and it's a bad one. Then I get temporary paralysis. But what I want people to know about functional neurological disorder, which is also called non-epileptic seizures or psychogenic non-epileptic seizures. It's also called conversion disorder. I'm just going to call it FND for functional neurological disorder. So I got diagnosed with that in 2015 after going to the Cleveland Clinic, and they ran just a quick EEG, and I had convulsions. Then when I got back home, I went to another neurologist, and they did a 72-hour EEG. So, and I was videotaping myself the whole time. And the neurologist that reviewed the tape said that it was non-epileptic. So another way to think of it is these type of seizures originate in your nervous system as opposed to parts of the brain, like the hippocampus. So it's just where the seizure starts within the body. And usually with FND, stress, trauma, PTSD, anxiety, all of that goes hand in hand with that. I was diagnosed in 2015, but I really think I had some form of functional neurological disorder because there are multiple symptoms. It's not just convulsions or paralysis. You also have extreme fatigue, headaches, sensory overload, gastrointestinal. It can affect every single area of your life. I'm blessed to have an amazing support team of my husband and son. They take good care of me, and we learn to laugh through through the hard times. For example, sometimes we play charades because the words are in my head and I can't get them out. So I point to stuff and they're trying to guess what it is I'm saying. So it's been really hard. It's an adjustment period. I think it has made my son a lot more compassionate and patient and kind. He was about 7 when I got really sick. The seizures started really getting bad right after I had Guillain-Barre in 2014, which is a rare autoimmune neuromuscular disorder. So shortly after that, I started having the non-epileptic seizures. But at the time, we thought it was epilepsy till we did the 72-hour EEG because the convulsions look very similar. Mine can last from just a few minutes to a few hours. I've had some off and on for 24 hours. It's triggered by stress. It's also triggered by fatigue. If I've done a lot of walking or I went swimming at the gym, I will also have an episode. Sensory overload is a big trigger. Flashing lights. All of those are triggers. I just want to wrap up with saying if you have any questions, the biggest question I get is, can you have epilepsy and non-epileptic seizures? And the answer is yes. My neurologist said that's actually very common to have both. In the kind that I have, I only have it on the right side of my body, which is more conducive to the FND, non-epileptic seizures, as opposed to the epilepsy. I can be reached at www.chronicpainhacker.com. I'm on social media with a handle of chronic pain hacker. I'm on Instagram the most. Feel free to send me a message if you suffer from FND or know someone who does. I'd be glad to answer questions and be of any support that I can. Thank you and have a blessed day.